Do tooth gems cause cavities? Let's talk. Hi, my name is Whitney and I'm a dental hygienist here to talk about tooth gems. First of all, what are they? Tooth gems were actually a very popular trend back in the 1990s and early 2000s, and just like low-rise jeans, they're starting to make a comeback. Tooth jewelry isn't anything new to our lifetime either, because in fact, it goes back thousands of years in cultures like the ancient Mayans. So just like a tiny nose piercing, tooth gems can look similar on your teeth. They are small crystals that sparkle on your teeth when the light hits them just right. And there are two types of tooth gems: temporary and permanent. Temporary gems are removable, and similar to orthodontic brackets, that's a good analogy, they're held there with a special bonding agent over the surface of your tooth, whereas permanent tooth gems are fitted inside a hole that's created in your tooth structure. So whether they are temporary or permanent, the gem can be a basic rhinestone or an inexpensive crystal, or as fancy as a solid diamond or a sapphire. There are actually even Swarovski crystals specifically branded for use on your teeth. So if you're thinking about putting them on your teeth, here are some things to consider before investing in any type of tooth jewelry. Do not try DIY tooth gems. If you want to get them on your teeth, my best advice is to schedule an appointment at your dental office to discuss your options, because if you try to do them yourself at home, well, first of all, you run the risk of trapping bacteria between the tooth jewelry and the enamel, which can cause immediate cavities. And second, the at-home glue could either be toxic, like super glue, don't be using super glue, or it might be some type of glue that is not as strong as what your dentist uses, so the tooth gem will just fall off easily and you'll probably swallow it. Also, if you're trying to place the gem on yourself and you mess up the positioning in relation to your gum line and how your teeth bite together, it could actually cause lesions on your soft tissue and increase your chances of breaking an opposing tooth when you bite down. And or if the tooth gems are placed too close to your gums, they can trigger swelling and bleeding in those areas, especially if you are gingivitis prone. So always, always, always get a consultation at your dental office. If your dentist places tooth gems, they will usually give you the option. And then once you get the consultation, your dentist will tell you whether or not they place tooth gems. If they do, they will usually give you the option of either temporary tooth gems or permanent tooth gems. I would not recommend permanent unless you really know you want it for years and years, because they actually have to drill a hole on your tooth for the permanent ones. It's a similar process to filling a cavity. They drill a hole and they fill it in with a gem instead of filling material. And if you ever do decide you don't want it anymore, they would have to put filling material in that hole now, since it's an open hole. So by getting a permanent tooth gem, you're kind of damaging healthy tooth. You gotta think about, is it worth damaging a healthy tooth? So if you do decide to get a tooth gem, getting a temporary one is usually your best bet. The process of temporary tooth gems, what they do, they use a special etchant to gently roughen the surface of your tooth so that the bonding agent adheres properly. Then the glue, which is a medical grade bonding agent, it's not super glue, it's a medical grade bonding agent. This glue would be applied and then the gem would be placed and everything gets cured and hardened into place. Now, the big question is, can tooth gems give you cavities? So tooth gems, whether they are temporary or permanent, they are prone to getting plaque and food buildup around them, kind of like with braces, right? There's a lot of little crevices around the gem where food debris can get trapped. So to prevent cavities with tooth gems, oral hygiene routines need to be extra thorough. You gotta go extra. It's best to use a soft toothbrush around each side of your tooth gem to clean around all the edges. That way you can make sure there's no plaque creating a ring around the gem, like you would see with an orthodontic bracket. Also, when you choose to get them removed, the last thing you want is a dark stain spot or a white decalcified spot that forms underneath the gem from not keeping them clean. Again, very similar for when some people get their braces off, this happens. This happens when they don't keep their teeth clean enough. As for electric toothbrushes, they are 100% recommended with permanent tooth gems. However, for the temporary ones, I've seen some mixed reviews. Some dental professionals totally recommend them, while others don't. But there isn't much dental hygiene research revolving around tooth gems, right? Like, this is a lot of word of mouth from dentists where I got this information. So really, my best advice is to ask the dentist who placed the gem on your tooth. Ask them which toothbrush they think is best to use, because they put it on there and they can tell you about your teeth better than anyone on the internet can. You know what I'm saying? Because again, if you don't have a good enough oral hygiene routine and you're skipping over a little plaque every day, these gemstones on your teeth can easily trap bacteria, and it would only be a matter of time before that part of your tooth gets a cavity and a stain starts forming underneath it, which would be so sad because assuming you got the tooth gem for cosmetic reasons, now you have a brown or white spot on that tooth. That's the complete opposite of cosmetics, right? So just be sure you brush really well around them. Take your dentist and your dental hygienist advice with whatever toothbrush they recommend for you. The good thing is that most tooth gems are bonded to the front teeth, and the front teeth do tend to be easier to clean because you can look at them straight in the mirror. You can see them clearly, right? So that's a good thing. Also, knowing that most tooth gems are temporary means you won't have to worry about any long-term maintenance, because a typical temporary tooth gem usually lasts about 6 to 12 months. Some factors that can cause your tooth jewelry to fall off before that are brushing too hard or not using a soft toothbrush. Don't use hard or firm toothbrushes. Biting down on something hard or crunchy like a carrot or an apple. Acidic diets can sometimes cause the bonding agents to fail. And of course, not having your gemstones attached by a dental professional with the right type of bonding agent. Again, don't use super glue or any other DIY at-home glue. And before we go, don't you want to know how they are taken off your teeth? For the temporary ones, your dentist will simply pop them off, sort of the same way they do a bracket if you had braces. Then they will buff the area where the glue was and make your tooth feel nice and smooth. Again, the best analogy or comparison is like when you have your braces and you get your brackets removed. And remember, for the permanent ones, to remove them is a much more involved and complicated process because there will be a hole left in your tooth that needs to be filled up, like when you get your cavity filled. How much do tooth gems cost? The price tag for putting a tooth gem on your tooth will depend on two things. One, the fee charged by your dentist, and two, the type of crystal you're getting, right? Of course, you're going to pay more for a real diamond or sapphire than you would for an inexpensive little rhinestone. So if you're not putting an expensive gem in there, you could be paying as little as $50 for a dentist to install a tooth gem for you, but every office is different and lots of different things go into the cost of a procedure. So always call your dental office and ask ahead of time, and really call ahead of time to find out whether or not your dentist is comfortable installing one for you in the first place. And lastly, what are the biggest risks of getting a tooth gem? There's two. Number one is swallowing them. Things happen. Even when professionally placed, you might be eating something random and it'll pop off when you least expect it. And two, cavities. Like we said, you have to be extra careful about any plaque getting caught around them. So in all, tooth gems are safe to wear as long as you clean around them properly and have them applied by a licensed dental professional. Personally, I think temporary gemstones on teeth are better than the permanent ones because there's no physical alteration of your natural tooth structure. I hope this video helped you. Please like, subscribe, and turn on your notifications if it did. And if you want more teeth talk, you can visit my website, teethtalkgirl.com, and hang out with me on Instagram @teethtalkgirl. Peace, love, and teeth.